something we all wonder about, very practical aspect of this whole matter of dealing with glaucoma. What eye pressure is right for me? Dr. Reddy will talk to us about that.
Hello, good afternoon, everybody. My name is Swathi Reddy. I'm one of the glaucoma clinical fellows here at Wills. And today I want to talk to you all about a question that's very often posed to us right after we take our patient's pressure, which is that a right pressure for me? Or, what exactly is a good pressure for me? And so before we start or move any further, I want to reiterate, probably this has already been said before, but high pressure does not necessarily confer a diagnosis of glaucoma. High pressure does not equal glaucoma. Eye pressure, as we've heard before, is a risk factor for glaucoma. It's one of the modifiable risk factors that we have found for glaucoma. And when we say that it's a risk factor, what we mean to say is that, there are patients out there who have higher than average eye pressure, and they don't have any clinical signs of glaucoma. However, there are those patients who have lower than average eye pressures, and unfortunately, they do show signs of glaucoma progression or signs of glaucoma. So what exactly is a normal eye pressure? First of all, let's just start out by saying that there is absolutely no such thing as a normal eye pressure, in the sense that what is an eye pressure for one person that gives them a diagnosis of not having glaucoma may not be the same for another person. But what we can say for sure is that eye pressure above a certain threshold, for example, 30 to 35 millimeters of mercury, may be considered abnormal in the sense that you may not have glaucoma, but that your ophthalmologist will likely want to treat it with glaucoma drops because there are risks associated with a higher eye pressure, and so we'd like to minimize those risks. However, there is no guarantee that glaucoma damage will progress at this pressure, but we like to reduce the risk of this happening. And we treat because the risk of damage is higher at those higher pressures. So what is an average eye pressure? Here is a graph, and what you can see over here is this is supposed to represent the curve of eye pressure in patients who are normal. And we'll just say that those are patients who don't have glaucoma, not that they are normal. And this graph is meant to represent patients who do have glaucoma. And what you can see is that this curve is skewed towards higher pressures. And you see that the glaucoma prevalence, the prevalence of patients with glaucoma tends to be highest in this range around the 20s. And normal patients who do not have glaucoma, their average pressures tend to peak at around 15. But what you'll also notice is that there is this area right here, and these are outliers. These are patients who may be classified as normal, who may tend to have higher pressures, and these are also patients who are given a diagnosis of glaucoma who may also have pressure that is considered in the average range. And that's where a lot of the skill of treating patients with glaucoma comes into play. And so to begin to talk about what is a good eye pressure, we should understand what causes eye pressure in the eye. And eye pressure is a function of two basic things. And the first thing is inflow. And inflow, not necessarily what's coming into the eye, but what is being produced inside the eye, the amount of fluid that's being produced inside the eye. And outflow is how much of this fluid is leaving the eye via the trabecular meshwork or the drain that is inside the eye. So what we tend to find is that the amount of fluid produced in the eye tends to vary less. Of course, there are some specific situations in which there's less fluid being produced inside the eye, but we found that this tends to vary less. But the amount of fluid that is leaving the eye tends to vary more, and that's where a lot of our treatment is targeted at. Glaucoma medications, as we've heard before, work by controlling the amount of fluid being produced in the eye, as well as controlling the amount of fluid leaving the eye. And glaucoma surgeries primarily work by increasing the amount of fluid leaving the eye. So how do we decide what is normal? What is a normal eye pressure? And I say this in quotes because, as we've said before, there's no such thing. Every patient has an individual goal for pressure. And deciding what is that appropriate pressure for that patient is based on many different things, but primarily we decide what that is based on examination and the changes that we see in that exam over time. And so the things that we are very concerned about looking at when our patients come in for our exams are, number one, checking the eye pressure. We also are very interested in looking at the drain of the eye, the drainage angle, the trabecular meshwork, to see whether or not there's any kind of problems in that area. We also care about looking at the optic nerve, and we have found that this is probably the gold standard for seeing whether or not there's been any damage from glaucoma, and this tends to be the most reliable part of our exam. And we also pay very, very close attention not only to objective measures of visual field through visual field testing, but we care very much about your perception of what is going on with your own vision. Just because something is not being picked up on a visual field test does not mean that your vision is not being affected. And we take it very seriously when you notice any change to your vision, and that is definitely something to bring up when you see your glaucoma doctor. So just to show you, just give you a sense of what exactly we're looking at when we are taking a look at your eyes. This is an example of a normal optic nerve, a patient who does not have glaucoma. And what we can see here is that there is this inner part that we refer to as the cup. And this whole entire circle here is called the cup, the disc, I'm sorry. And we're looking to see the health of the tissue that's in between, and that's what we call the rim. This is a glaucomatous nerve, and the reason that this is a pretty classic picture of a glaucomatous nerve, and the reason that we can say this is that this cup appears somewhat a little bit larger, and this does not necessarily mean that a patient has glaucoma, but what is very interesting about this picture is that you see that there is a little bit of hemorrhage here. And that is a sign of glaucoma that we take very, very seriously. The other thing that we were looking at is that in this one area where there is that hemorrhage, there appears to be this area, this rim here appears to be a little bit thinner. And those are several clues. I won't go into too much detail, but those are some clues to us that there has been damage to the nerve. And when we see that, our alarm goes up. I don't know if any of you have seen these before, but these are just examples of visual field testing. It is often the bane of many glaucoma patients' existence, and ours as well, because they're often very difficult to interpret, and they're also even more difficult to take. This is considered to be a normal visual field. For the most part, what you can see is this dark spot here is the blind spot. It's a physiologic blind spot. We don't expect there to be much vision in that area. But as you can see, for the most part, the visual field appears fairly unaffected. This is an example of a glaucomatous visual field in the sense that this is a very common pattern for visual field loss. This is called an arcuate defect. If we saw this on a visual field, it does not necessarily 100% mean that this patient has glaucoma, but it would allow us to know that we should look very, very closely for other signs of glaucoma. So if we were to have one patient who over time had a field that initially looked like this field and over time developed a field that looked like this one, we would know that we would have to take action. So this is what we want to know. We want to know what has been your range of eye pressures. We also want to know if there has been a change in the appearance of your optic disc. And we also want to know if there has been a change to your visual field, both objective and subjective. So just to kind of summarize what our thinking process is, if we have seen that there has been no change to your optic nerve or the vision and your field, then probably your range of pressures is in a good range, and we can probably continue to watch you. But if there has been a change to your optic nerve and or the vision and the field, the eye pressure should likely be lower. And of course, there are many exceptions to the rule, but this is our thought process. So deciding what is the right pressure for you takes more than one exam, and it changes over time, which is why the most important part of glaucoma is routine examination. It's very, very important that you see your eye doctor, keep your appointments, because things can change, and based on these changes, we change our target and we change our goals for you. And our goal is not necessarily only to preserve your vision, but we want to preserve your quality of life. And anything that we can do to help you in that regard, we want to do that. that's all I have to say. Does anybody have any questions? Okay, great.